The Badaya Health Centre. This woman has just arrived with her baby who has a respiratory infection. Like malaria, it's a common illness among children here. To save them, the teams need to act quickly.
Our patients are from the whole Paua region. They can come from as far as 60 kilometers away. Patients are often referred to the hospital by motorbike from the MSF-run health centers.
That was a call from Paua Hospital. A patient with a head injury has just arrived and has been rushed into the operating room. The 150-bed hospital also treats malnutrition, pediatric and obstetric cases, HIV/AIDS and tuberculosis. After years of political instability, the country's healthcare needs are immense and outweigh by far the means available.
The emergency phase is over, but a lot remains to be done. We need to get the health facilities that used to exist up and running again.
Armed fighting ceased in the northwest of the country more than a year ago. Improved security conditions have allowed MSF to extend its work to health centres around Paua. The primary objective is to reduce the region's infant mortality rate as soon as possible.
This is a patient who has already been pregnant 11 times. Such cases are referred to the hospital because they're at risk of a complicated birth, of hemorrhaging during delivery.
Nearly 300 women give birth each month at Rutshuru Hospital in the east of the Democratic Republic of Congo.
Sometimes you can feel a little ineffective, a little useless in the face of such an enormous task. The work here is immense and complex, and the need for assistance is considerable.
Many babies here are delivered by caesarean, a potentially dangerous operation for the mother if performed repeatedly. To improve the quality of care, the MSF team has been training the local staff in different techniques in obstetrics and gynecology.
I think to do the job, you have to take it day by day. Sure, we can treat patients, but really, we're there to help local staff provide better care. To help them understand that, with relatively few means, you can save lives. And that's a big success.
In November, the maternity unit was placed back under the responsibility of the Ministry of Health. But MSF will continue training medical staff. In less than a year, the team has reduced the number of births by caesarean from 46% to 32%. Defibrillators, ECGs, Holter monitors. A year ago, no such means or equipment were to be found in the emergency hospital of Grozny in Chechnya. But all that began to change at the end of 2010, when MSF set up a project for cardiac emergencies and intensive care.
We didn't have all this in Chechnya before. We couldn't provide life-saving care in time. We couldn't perform thrombolysis to break down blood clots, so the mortality rate was high.
MSF provided the equipment and medical supplies, and the first consultations took place in February.
In July 2011, thrombolysis was performed for the first time at the hospital. We've done it several times since. Our doctors are very proud to be able to provide such care for their patients. It saved 4 lives.
Since February 2011, 600 people have been admitted to the cardiac care unit. Doctors hope to reduce the number of deaths related to cardiovascular diseases, the cause of 60 to 70% of deaths in Chechnya. Since introducing antiretrovirals to its HIV programs in 2001, MSF has continuously worked to improve the quality of care and increase the number of patients treated. In Chechnya, MSF has treated 53,000 patients in 10 years.
If I hadn't been given ARVs, I would be dead by now. But I have ARVs, and I'm thankful for that. I know that if I continue taking ARVs, I will have a good life until God decides to take it back.
In October 2011, the Chechnya team implemented the new World Health Organization guidelines supported by Malawi. These changes are essential to improving public health, but they come at a high price and at a time when international funds are declining. MSF, though, remains committed and will continue to follow its patients in Malawi for at least another decade.